Hello guys, I hope you guys are doing good. Today we're gonna discuss 10 Nclex questions with rational answers. Question number 1. A client diagnosed with myasthenia gravis is experiencing prolonged periods of weakness, and the primary healthcare provider prescribed an ederphonium test, also known as tensilon test. A test dose is administered and the client becomes weaker. How should the nurse interpret these results? Myasthenic crisis is present. Cholinergic crisis is present. This result is a normal finding, or this result is a positive finding. The answer is number 2. Cholinergic crisis is present. An ederphonium test may be performed to determine whether increasing weakness in a client with previously diagnosed myasthenic is a result of cholinergic crisis, over medication with anticholinesterase medications, or myasthenic crisis under medication. Worsening of the symptom after the test dose of medication is administered indicates a cholinergic crisis. Question number 2. The nurse notes an isolated premature ventricular contraction (PVC) on the cardiac monitor of a client's recovery from anesthesia. Which action would the nurse take? Prepare for defibrillation, continue to monitor the rhythm, prepare to administer a beta blocker, notify the primary healthcare provider immediately. The answer is number 2. Continue to monitor the rhythm. As an isolated occurrence, the PVC is not life-threatening. In this situation, the nurse should continue to monitor the clients. Frequent PVCs, however, may be precursor of more life-threatening rhythms such as ventricular tachycardia and ventricular fibrillation. If this occurs, the primary healthcare provider needs to be notified. Defibrillation is done to treat ventricular fibrillation. A beta blocker may be prescribed to treat frequent PVCs but are not prescribed to treat an isolated occurrence. Question number 3. During the postoperative period, the client who underwent a pelvic excenteration reports pain in the calf area. Which action would the nurse take? Ask the client to walk and observe the gait. Lightly massage the calf area to relieve the pain. Check the calf area for temperature, color, and size. Administer as needed PRN, morphine sulfate, as prescribed for postoperative pain. The answer is the third one. Check the calf area for temperature, color, and size. The nurse monitors the postoperative client for complications such as deep vein thrombosis, pulmonary emboli, and wound infection. Pain in the calf area could indicate a deep vein thrombosis. Changing color, temperature, or size of the client's calf could also indicate this complication. Option 1 and 2 could cause a possible thrombosis to break loose, resulting in an embolus. Administering pain medication for this client is not appropriate nursing action, since further assessment needs to take place. The primary signs of deep vein thrombosis are calf or groin tenderness and pain and sudden onset of unilateral swelling of the leg. Question number 4. The client with atrial fibrillation is prescribed Sutalol AF. Which assessment finding indicates that the client is experiencing an adverse effect of the medication? Dry mouth, diaphoresis, difficulty swelling, or dizziness and feeling faint? The answer is number 4. Dizziness and feeling faint. Sutalol AF is a beta-adrenergic blocking agent that may be prescribed to treat atrial fibrillation or atrial flutter. Adverse effects include headache with chest pain and severe dizziness, fainting, fast or pounding heartbeats. Remember that the medication names ending with the letter LOL, like Sutalol, are beta blockers which are commonly used for cardiac disorders. Question number 5. A client was admitted to the hospital 24 hours ago after sustaining blunt chest trauma. which is the earliest clinical manifestation of the acute respiratory distress syndrome the nurse should monitor for. Sinuses with accompanying pallor, diffuse crackles and rhonchi on the chest auscultation, increase in respiratory rate from 18 to 30 breaths per minute, or diffuse haziness or white-out appearance of lungs on chest radiograph. The answer is number 3, increase in respiratory rate from 18 to 30 breaths per minute. ARDS usually develops within 24 to 48 hours after an initiating event such as chest trauma. In most cases, tachypnea and dyspnea are the earliest clinical manifestation as the body compensates for mild hypoxemia through hyperventilation. Sinuses and pallor are the late findings and are the result of the severe hypoxemia. Breath sounds in the earliest stage of ARDS are usually clear, but then progress to diffuse crackles and rhonchi as pulmonary edema occurs. Chest radiographic finding may be normal during the earliest stages, but will show diffuse haziness or white-out appearance in the later stages. Question number 6. The nurse caring for a client with buck traction is monitoring the client for complication of the traction, which assessment finding indicates a complication of this form of traction. Weak pedal pulses, drainage at the pine sites, complaints of the leg discomfort, or toes are warm and demonstrate a brisk capillary refill. The answer is number 1, weak pedal pulses. Buck traction is a skin traction. Weak pedal pulses are a sign of vascular compromise, which can be caused by pressure on the tissues of the leg by the elastic bandage or prefabricated boot used to secure this type of traction. A skeletal traction uses pin, not skin tractions. Discomfort is expected, and warm toes with brisk capillary refill is a normal finding. Question number 7. A parental client has a suspected diagnosis of iron deficiency anemia. On assessment, which finding would the nurse expect to note as a result of this condition? Dehydration, fluid overload, a high hematocrit level, or a low hemoglobin level? The answer is number 4, a low hemoglobin level. Pathological anemia of pregnancy is primarily caused by iron deficiency. When the hemoglobin level is below 11, iron deficiency is suspected. An indirect index of the oxygen carrying capacity is determined via a packed red blood cell volume or hematocrit level. Dehydration and overhydration are not specifically associated with iron deficiency anemia. The ferritin level is a laboratory test that is used to diagnose iron deficiency anemia. For a female, a ferritin level of less than 10 confirms the diagnosis. Question number 8. The nurse caring for a postpartum client should suspect that the client is experiencing endometriosis if what is noted during an assessment: breast engorgement, elevated white blood cell count, leukia rubra on the second day postpartum, or fever over 38 beginning 2 days postpartum. The answer is number 4, fever over 38 beginning 2 days postpartum. Endometritis is a common cause of postpartum infection. The presence of fever of 38 or more on 2 successive days of the first 10 postpartum days is indicative of a postpartum infection. Breast engorgement is a normal response in the postpartum period and is not associated with endometritis. The white blood cell count of a postpartum woman is normally elevated. Thus, this method of detecting infection is not of great value in the puerperium. Also, leukia rubra on the second day of postpartum is a normal finding. Question number 9. The nurse is caring for a client who had an orthopedic injury of the leg that required surgery and application of a cast. Postoperatively, which nursing assessment is of highest priority to ensure client safety? Monitoring for heel breakdown, monitoring for bladder distension, monitoring for extremity shortening, or monitoring for blanching ability of toenail beds? The answer is number 4, monitoring for blanching ability of toenail beds. With CAST application, concern for compartment syndrome development is of the highest priority. If post-surgical edema compromises circulation, the client will demonstrate numbness, tingling, loss of blanching of toenail beds, and pain that would not be relieved by opioids. Although heel breakdown, bladder distension, or extremity shortening can occur, these complications are not potentially life-threatening complications. Also, another nursing tip: monitor the client with a cast for early signs of compartment syndrome. Assess the client for the 6 P's, which include pain, pressure, paralysis, paresthesia, pallor, and pulselessness. And finally, the last question: a client experiencing an exacerbation of their asthma symptom requires mechanical ventilation. An arterial blood gas (ABG) specimen is to be sent to laboratory for analysis. What information would a nurse include on the laboratory requisition? Select all that apply. Ventilator setting, a list of client allergies, the client's temperature, the date and the time the specimen was drawn, any supplemental oxygen the client is receiving, or extremity from which the specimen was obtained. The correct answer include number 1, number 3, number 4, and number 5. An ABG requisition usually contains information about the date and the time the specimen was drawn, the client's temperature, whether the specimen was drawn under room air or using supplemental oxygen, and the ventilator setting if the client is on a mechanical ventilator. The client allergies and the extremity from which the specimen was drawn do not have a direct bearing on the laboratory results. Thank you guys for watching the whole video. I hope that it was useful for you guys. If you guys are currently preparing for your Nclex exam, make sure to subscribe our channel because we're about to smash the Nclex exam.